Surgeon Dr. Amilani is there, and today I am going to discuss about the calcium supplementation on the surgical floor. First of all, you must know in which form present in the market. It's present in the form of tablets. It's present in the form of tablet Calsan, which contains calcium carbonate, and its strength is 1250 milligram. Okay. Then you have got the tablet CAC 1000. Again, it contains same calcium carbonate in the same dose, and then in the form of in the injectables, you have got the calcium gluconate. So it's present in 10%. Then you have got the tablet 1-alpha Leo, 1-alpha Leo, and it contains the vitamin D in the dose of 0.025 micrograms. Okay. Then there is a concept of the corrected calcium. So in the next section. Okay. Then there is a concept of corrected calcium. So we must know its formula is equal to calcium plus 0.8 into 44 minus serum albumin. Okay. So putting the values, suppose your calcium is 7.8. Okay, and you add plus again 0.8 into 44 minus, suppose your serum albumin it's 40. Okay. Now putting the values, its value come out to be 8.12 mg per dl. Okay. And what's the normal calcium value? We must know normal calcium value. So it's around 8.5 into 10.5 mg per dl. Okay. Then we have got the concept of elemental calcium. Elemental calcium. Okay. It's the actual amount of the calcium which is present in the supplements. Suppose in calcium carbonate it's 40% minus it's 40%. Suppose you have got 1250 milligram, it will only contain 500 milligram of the calcium. In case of Calsan it's the same. So in case of the calcium gluconate, okay, its value is 9%. Okay. So it's present in 10% in 10 ml. So 9% will contain 1 gram is equal to 90 milligram. Okay. So now there is a concept that what's the normal requirement. So for the calcium it's 1 to 3 gram per dl. Okay. And its maximum value is 6 grams. Okay. And you have to give it half hour after meal. Okay. In case of vitamin D, its requirement is 0.25 to 0.5 microgram per dl. Okay. And again its maximum value is 2 microgram per day. And now there are some factors which affect the calcium levels. Factors affecting the calcium absorption. So what are those factors? You must consider these factors. These are potassium, then we have got magnesium, then we have got the phosphate, then we have got the urinary calcium level, and one thing you must not forget, that's the omeprazole. Okay, now you will be given two scenarios. Okay, the post thyroidectomy numbness is there, suppose. Dectomy numbness is there only. Then what will you do? You will give the calcium gluconate, then 10%, 10 ml over 10 minutes. You will give this in stat dose. After that, you will give in BD or in TDS dose, and then you will add oral. Now, oral calcium gluconate. So in the form of 3 gram per day. And you will definitely also give the vitamin D in 0.5 microgram per day. Okay, and you will send labs. Okay, definitely all the factors which were affecting serum calcium level, you will send albumin level, magnesium level, phosphate level, potassium level, and one thing you must remember, you will stop omeprazole. Okay, you will stop omeprazole. Then after that, you will assess after 24 hours. 24 hours. Okay, and your aims will be the patient should be symptom free on oral supplementation. Okay, and before that you will increase oral calcium and you will decrease the injectable calcium until unless patient is symptom free on the oral supplementation. Then after that you can discharge and you can call for the follow-up of this patient. So this was the one scenario. The other scenario, that's the if the patient has got the post thyroidectomy, carpopedal spasm. That's the severe form of the hypocalcemia. So in that case, you will give the injection. In case of IV, 10% calcium gluconate, 10 ml over 10 minutes in stat dose. Okay, then you will look for the symptoms. If symptoms don't resolve, you will repeat IV calcium. Okay, and again if symptoms don't subside, you can repeat for a third time. Now again, if the symptoms don't resolve, then what you have the option, You have the option, and now you will take 5 ampules of calcium gluconate, okay, and you will add this in 500 ml dextrose saline over 24 hours, okay. And with this, from here onward, the scenario will be same. Now again, you will add oral calcium, plus you will add the vitamin D, and the scenario, it will be same as previously I have discussed. You will add the oral calcium in the dose of 3 gram per day, and you will add vitamin D. You will add the vitamin D in 0.5 microgram per day, and you will send the labs serum calcium level, albumin level, magnesium level, phosphate level, and the potassium level, and moreover you will stop the omeprazole, okay. And you will assess after 24 hours, and your aim, you will increase the dose of the oral calcium, and you will decrease the dose of the you can say that IV calcium, unless a patient is symptom free on the oral supplementation, and now you can discharge the patient, and you can call the patient for the follow-up. So this was all about the calcium supplementation in case of post thyroidectomy numbness, and in case of the post thyroidectomy carpopedal spasm. So that's all for today. So thank you so much for watching the video. Thank you so much. If you like our content, if you learned something from our videos, then do subscribe by clicking on the red button below. So thank you so much.